My name is Reginald Bullock, and today is day 35 of me being cancer free as a cancer survivor. On December 19th, 2023, I went in for surgery for prostate removal. And 35 days later, I'm recovering well. I am getting back my strength. I'm starting to do a little bit of cardio and stretching. In another couple of weeks, I'll be doing more exercises. So I'm fine. I wrote some notes down because I wanted to do a public service announcement. And first and foremost, men who are listening to this, get checked. Men who are listening to me right now, get checked for prostate cancer and get checked for colon cancer. So get your prostate checked and your colon checked. How do you do that? Blood sample for the prostate, and you can do a specimen for your colon. We'll get into that. I'm in good company, so to speak. I say that because I'm not the only person who has undergone prostate treatment, prostate removal, and who has had prostate cancer. So I have a list of some other folks who had prostate cancer and went through a procedure. Nelson Mandela. Sadly, recently, Dexter King, son of Dr. Martin Luther King Jr., passed away this week due to complications in a battle with prostate cancer. Now, as I run through this list, I'm going to say that I don't know the full details of everybody's situation on this list. Some may have had prostate removal. They may have had some other type of surgical thing done to their prostate. And some may have battled with prostate cancer for a long time. Some may have found out they had prostate cancer at stage 3 or stage 4. Some it may even have metastasized. So I don't know everybody's situation. But I want all of the men to know that this is a common thing. And if you do not know whether or not you have cancer, you need to get checked. Get checked. So Nelson Mandela, Dexter King, Colin Powell, Defense Secretary Lloyd Austin recently found out he had prostate cancer. King Charles of England, although, they're not saying everything, but it's probably prostate. Robert De Niro, Roger Moore, James Bond, Roger Moore, John Kerry, Ken Griffey Sr., Arnold Palmer, Harry Belafonte, Warren Buffett, Ben Stiller, Sidney Poitier, and Frank Zappa, Al Roker, Rod Stewart, all had prostate cancer. And I did too. So get checked. Public service announcement. Get checked. 13 out of 100 men will get it. Think about it. If you are ever in a room with 100 men, that means 13 minimum will probably get prostate cancer. And if you're in the room with 100 black men, then it's probably going to be 16 who get prostate cancer or more, maybe even 26, double that. So the point is, get checked. 2 to 3 men will die. Now I say that because it's the truth, right? And as I hear stories from my journey, I am learning how many men are deathly afraid of prostate cancer because it's cancer. But the reality is, if you get checked early and you know you have it, there's something you can do about it. But if you wait, like Chadwick Boseman, he had colon cancer, stage 4. If you find out you have cancer and it's stage 4 already, that means you should have got checked early. So get checked. The older you are, the greater your chance of getting it. I'm 61 years old. I didn't have cancer when I was 51 years old, but I'm 61 years old. And there are people who are turning 71 and 81 finding out they have prostate cancer. So the older you get, the higher the chances are that you will get it. And therefore, you need to be concerned about your risk factor. So let's shift a little bit, right? Because here is the challenge with most men that I'm talking to. Erectile dysfunction and infertility. It made it taboo to talk about it, right? Men don't want to talk about my penis will not get erected or I cannot get anybody pregnant. Those are two things that men don't really like to talk about. But I'm talking about it because it's real. So if you have prostate cancer, or prostate surgery, there's a chance that you could actually get erectile dysfunction for a small period of time, right? You know, it's different for everybody. But I'm talking about it because the reality is you are still alive. So get checked, and if you need to, go through treatment or whatever, go through it. Just on a side note, because we have to have this discussion, if you do not get checked and you do not know, then what? So erectile dysfunction, infertility, I get it. And I know that, as men, we want to be able to have our full function all the time. I get it. But if you're not alive, now what? So what? If you're not alive, so get checked. Public service announcement. I know you're going to get tired of me saying it. Reggie, just why you keep saying it? Because it's saving lives. Since the 19th of December, I've talked to so many people in so many professions all over the world, and it's saving lives. So what is the prostate? The prostate is a part of the male reproductive system and is located in the pelvis between the penis and the bladder. It's a small gland around the size of a walnut, and its function is to produce a white fluid that partly makes up the semen. So it's seminal fluid, right? Men, trans women, non-binary people who are assigned male at birth, and some intersex people have prostates. Let me repeat that. Men, trans women, non-binary people who were assigned male at birth, and some intersex people have prostates. Therefore, regardless of your designation, get checked if you have a prostate. Bottom line, if your body has a prostate, get it checked, learn your PSA, and know what you need to know. So what is prostate cancer? Prostate cancer can develop when cells in the prostate start to grow in an uncontrolled way. You got cells, and when they start growing in an uncontrolled way, you got prostate cancer. And I want to just kind of deviate a little bit on what I was thinking of talking about, and that is stages. So my prostate cancer was caught, and it was at stage 3. And initially I had a PSA done, and then I had an MRI. The MRI showed something on the prostate. Then we had the biopsy. The biopsy definitely said I had prostate cancer, made the decision to have it removed. If I didn't have it removed, what could have happened? Well, the cancer could have spread to my bladder. It could have spread to various organs. It could have spread to my colon. It could have spread a lot of different places throughout my body. And therefore, it will have metastasized. And now it's beyond my prostate, uncontrollable. And I would have to do other things to just prolong my life. Fortunately, I caught it early. Get checked. Now, while I was in the hospital, my cousin was also in the hospital for colon cancer, and he had to have about a foot of his colon removed. He's currently going through chemotherapy every other week. I didn't have to go through radiation or chemotherapy. I'm not taking any medication or any of those types of things. For me, it's life back to normal, minus a couple of things that's going to take a few months to get to where it needs to get to. But I got checked early. You need to get checked early. What are the symptoms of prostate cancer? Prostate cancer typically develops slowly in men, so men might not notice any signs over the years. So you could be having prostate cancer right now, not know it, not feel it, there's no sign. Some symptoms do appear that usually happen when the prostate becomes large enough to impact the urethra. What's the urethra? It's that tube that runs through your penis that's connected to your bladder and connected to your testicles by way of other parts of your body so that fluid comes out. So your urethra is that tube that allows fluid to come out. Now, when the prostate enlarges and presses on that, things can happen. And some of the things could be you have an increased need to pee, you're straining while you're peeing, and you're feeling your bladder is not fully empty. So these are various things. You could even have, what do they call it, a UTI, urinary tract infection, which Doesn't happen often in men. So men, if you get that, get checked. So these are some of the things that, I wanted to talk about, but the reality is I survived it. You can survive it. I'm listening to so many stories. I have a friend right now. He is a week post-surgery. He had prostate cancer. He had his prostate removed, and he and I are talking. I was talking to an attorney yesterday who gets a lot of disclosure from people, and he said, Reggie, men are afraid. They are just scared. They have a fear. And so they don't want to get checked. They don't want to know, because to know means you got to deal with it. Well, you have friends and family and children and other people who rely on you, who care about you. Get checked. Ladies, you know men, right? You have fathers and brothers and sons and uncles and friends and acquaintances and significant others and just people, co-workers, right? Term work husband, right? So share information with them. Share this video with them and tell them to get checked. Again, here's the question. Do you or don't you know whether or not you have cancer? If you don't know, find out yes or no. Well, ladies, use this video, use the information, and share it with the people that you know to help them. Now, men, ladies go through a lot. They go through a tremendous amount of experiences, starting as early as teenagers. We're not built the way they are. So I get it. Women are strong. Men, we're not as strong as women. But they go through all types of poking and prodding and checking and getting samples and all of those types of things. And then they deal with it. Here's another thing. Outside of prostate and colon cancer, children get cancer. Children get cancer. Children as young as age 1 or not even age 1 have cancer. 6-year-olds have cancer. 10-year-olds have cancer. So this is serious. And there are children, 6-year-old children going through chemo, radiation, and dealing with it with a smile. So men, get checked. Get checked. I had a cousin who found out for the first time his PSA, and it was over 1,800. My PSA was a 10, which was high. If your PSA is below a 3, you can do the monitoring. I say talk to your doctor for all of that. But if it's below a 3, you're not a high risk. Mine was a 10. I was a high risk. I did MRI, biopsy. My cousin found out 1,800 plus. So he was not really a candidate for a whole lot of things, stage 4. And he didn't live long after that. Another friend, he found out he had a 550 something. And then after his biopsy, it was 700 and something. So he's managing it now. Get checked. Again, this is a public service announcement because I am cancer free. I am a survivor. I want you to be cancer free. I want you who have it to be survivors. And therefore, this is one of the best things that I can do as opposed to doing nothing. Again, I'm Reginald Bullock. And if you want to message me and you want to talk and you're going through it and you have that fear factor or you're scared or you're nervous, you don't know what to do, I'm not a doctor, but I'll give you a few minutes of my time just to help you along your journey. Have a blessed day, a peaceful day, and get checked.